Hi everyone, it's Rajiv Ramchand here. Sixth session in our series on the basics of epidemiology, and today we're going to be talking about outbreak investigations. So a lot of this information, and all of this information really, comes from the Center for Disease Control's website, which provides a really great resource on all about outbreak investigations. And they present 13 stages during an outbreak investigation, and I'm going to go through each of these stages really quickly. So the first is preparing your field work. What you want to do here is make sure that you know as much as you can about the disease and the situation, the context that you're going into. That includes bringing the right equipment. We want to make sure that we have the right equipment for taking specimens, human specimens if we need it, as well as environmental specimens, things from the water, things from the dirt, things from the earth, but also that we have the right equipment to protect ourselves as investigators to make sure that we don't acquire the infection and that we stay healthy. The second is to make sure that what we're seeing is indeed an outbreak. Remember from session one, we discussed clusters versus an outbreak. A cluster was an increase in cases, people presenting with the disease. An outbreak is when we have confirmed that this increase in cases is greater than what would be expected. Coming up with that, what would be expected, is actually quite hard. There's different strategies for doing it, and it's context dependent. So for a certain disease, you might be able to look, well, how many cases did we see last week or last month? But for some other things that might be seasonal, like flu, for example, we might need to look at last year. In this month last year, what were the number of flu cases that we saw? What were whatever we're looking at? So we have to think really carefully about our comparison group to make that determination that this is indeed exceeds what would have been expected. We then want to verify our diagnosis. So when we learned about this outbreak, this increase in cases, we had data coming in from multiple sources. We just want to make sure that all of these sources we're talking about relatively the same thing. We also want to talk to a few of the patients or their families to understand their symptoms and their experience with the infection or the disease. And then we want to summarize some of those clinical features to make sure that we can make some determinations about the disease and its course. Next, what's most important is to construct a working case definition. This is the case definition established by the World Health Organization for COVID-19. And you see that there's three conditions. There's suspect cases, there's probable cases, and that's for whom we don't yet have a confirmative laboratory tests, and then confirmed cases, which require a laboratory test. There's also specification as to how these laboratory tests should be conducted to make sure that everyone, especially right now when we're talking about this pandemic, that everyone is talking about the same thing, that we're all talking about apples and not apples versus oranges or that nature. The fifth step is find our cases, all of them, and systematically record information about them. We want contact information so that we can reach back out to them. We want to know their demographic profile, their age, their gender, maybe their occupation. We want to know clinical features of the disease to make sure that they all meet that case definition. We know a little bit about the disease. We know whether it's digestive or respiratory. So we want to start collecting information on potential risk factors for that disease. What are the foods they ate? What are the areas that they went to where they could have inhaled kind of particles? And then we also want to know who's providing that information. What's the source of that information? This is an example, once you have all that information, of creating this case list. And this is from, again, the CDC's website, and it's from the 2001 anthrax investigation. And you'll see that a lot of information for each case is presented to help us understand and make some sense. And with this information, we can then do some descriptive epidemiology. And we usually do it with respect to time, place, and person. With respect to time, this graph on the right shows you the epidemiologic curve for COVID-19 in the United States as of March 30th. And what I can learn from this graph is the magnitude of disease. So I'm looking on the y-axis of cases, and you can see that it's over 150,000. And I can also tell that there's no plateau, there's no peak. So we're still at our it's still increasing. That's really informative. If this were to follow different patterns, we might learn, oh, it seems to have plateaued. Oh, we're in a stage of decreasing. We could also backtrack this information and try to identify if there was one point in time in which everyone became infected by, for example, eating food at a certain place at a certain time. We could backtrack our information to that event and start looking at things through that lens. So the curve tells us a lot of information. We also might want to plot cases geographically. This is the most famous example from Jon Snow in 1854, not from Game of Thrones, but he plotted deaths due to cholera in London and concluded or hypothesized that there was something about this pump, the Broad Street pump, that was contributing to the distribution of diseases, because all of these deaths seem to cluster around that pump. And with respect to person, we want to know who is getting sick. Maybe there's patterns in who's susceptible for disease. But we also might find a case of the sad case of Mary Mallon, who's otherwise known as Typhoid Mary, who unfortunately developed typhoid fever, but was asymptomatic from it. And everywhere she went, a lot of people became infected, and she lived a very sad life as a result. In fact, if you want to read more, I would encourage you to do so. But this is, again, the type of information we can get from descriptive epidemiology. Then we want to develop hypotheses. We've collected all this information. We've plotted this information about the disease with respect to place and time and person. So let's come up with some hypotheses as to what is the source of this outbreak? What is the one characteristic? How can we control the spread? We then want to evaluate those hypotheses epidemiologically, and there's very systematic ways to do that. I'm not going to go into it now because this is actually sessions 7, 8, and 9, where we're going to go through these systematic ways of looking at risk factors. But basically what we're trying to understand is whether what we observed, how does that compare with what would be expected? Is there definitive statistical proof to suggest that indeed my hypothesis was supported? Often, however, and this is the 9th step, we need to reconsider our hypotheses, refine them, and then reevaluate. If our hypothesis isn't supported, we go back to the drawing board and make a second hypothesis. Other times, our hypothesis is supported, but it isn't specific enough to give us the information we need. So we might find out that everyone sick went to a certain place, like a grocery store, but perhaps that grocery store is too large to really confirm anything. So maybe we want to know what aisle people were shopping in, what time they went to the grocery store, things of that nature, to become more specific in our hypothesis so that we can really control and understand the outbreak. We then need to compare the conclusions and our confirmed hypothesis with laboratory tests. So these are examples from, the CDC's website. Take the middle one. I was just talking about this. So people at a certain grocery store at a certain time develop Legionnaire's disease. Well, let's narrow it down, and a laboratory test in this case confirmed that indeed this Legionnaire's disease bacillus was isolated from water in the ultrasonic mist machine reservoir. That's the thing that sprays your fruit and vegetables. So they really were able to refine it not to the entire grocery store, but just to that area. And that came from a very specific hypothesis that the epidemiologists had. We then want to implement control and prevention measures. This is a really important step. What happened with Jon Snow's famous example is he went to that Broad Street pump and he ripped off the handle so that no one could access water from it to control the spread of cholera. But sometimes we might temporarily shut down businesses and operations to get a sense of the control of the spread. So again, we want to implement something to try to control the spread of the disease. We want to continue surveillance, however, because we need to make sure, well, did whatever we do to control the spread of disease, did it work? So we want to make sure that no new cases are being developed and that our control efforts are in place and that they're effective. We also want to make sure that there aren't additional ways that people are getting sick from the disease. The entire pipe system, for example. So we want to continue to do surveillance to see not only whether our intervention was effective, but also whether it was sufficient to control disease in that population. And then finally, we need to tell the public and our policymakers about what we did, what we found and what we recommend. And we also want to convey that in a written report because that helps the next outbreak investigation go back to our documentation and say, well, this other group went to community A looking at a similar disease, and they found it was traced to the misters in this grocery store. So that can inform our hypothesis going into the next investigation of a similar disease type. Outbreak investigations are happening all over the place and all the time in the United States. And there's a dedicated team of epidemiologists who are part of the Centers for Disease Control's Epidemic Intelligence Service who are really doing disease detective work and following these steps in a systematic way all the time to identify and respond to outbreaks and control the spread of disease. So that's it for this session. I hope it was informative. Remember, as always, stay safe, stay healthy, and stay informed. Thanks.